The U.S. is planning to invest $3.2 billion to develop antivirals to treat COVID-19 and other viruses that have the potential to become pandemics, moving to fill the gap in treatments for such serious illnesses as Ebola, dengue, West Nile and Middle East respiratory syndrome. A new program will invest in accelerating things that are already in progress for COVID-19 but also would work to come up with treatments for other viruses, said Dr. Anthony Fauci, the nation's top infectious disease expert and President Joe Biden's chief medical officer, the Associated Press reported. Fauci stressed, however, that vaccines would remain the key tool in tackling COVID, even as research has advanced to come up with better treatments than the existing antibodies and Gilead's antiviral remdesivir, which come with burdensome logistical hurdles as most must be given by IV in a hospital setting. Health experts have increasingly called for a convenient pill that patients could take themselves when symptoms first appear. The news comes amid growing concern about the spread of new variants of COVID, and especially of the Delta variant, a highly infectious strain that was first discovered in India. That variant is behind a spike in infections in the UK, even though that country has vaccinated more than 80% of its adult population. The UK recorded 11,000 daily cases Friday for the first time since February, as the new variant spreads rapidly. The Centers for Disease Control and Prevention aligned with the World Health Organization earlier this week in declaring the Delta variant to be one of concern, a more worrying assessment than the previous classification as of interest. Don't miss. Is it time for Americans to drop their infatuation with the PCR test? That's what this COVID-19 testing expert thinks. Earlier this week, the UK delayed its reopening plans by 4 weeks to give Britons more time to get vaccinated. UK Prime Minister Boris Johnson announced a 4-week extension to the country's COVID-19 restrictions Monday as the country deals with an increase in Delta variant infections. WSJ's Jason Douglas explains what that could mean for the global effort to contain the virus. Photo. Henry Nicholls, ReutersThe U.S. vaccine program, meanwhile, continues to slow with the number of fully vaccinated Americans rising to 147.8 million on Friday, or 44.5% of the total population, up from 44% on Thursday, according to the CDC's vaccine tracker. Some 176 million Americans have received at least one dose of the 2-dose vaccines developed by Pfizer Inc. PFE, -1.70% and German partner BioNTech SEBNTX, -0.83%, or Moderna Inc. Johnson & Johnson and -1.96.1-SHOT regimen is also authorized in the U.S., but the AstraZenecaAZN, +0.03% AZN, +0.01% 1 is not. Among adults 18 years and older, 55.2% of the population is fully vaccinated. Among adults 65 years and older, 42 million people, or 76.